Hello, everyone, and thank you for joining this e-conference from all the parts of the world. A word of thanks to Dr. Ankit Bhargava for taking the efforts to bring this conference to reality. And a big thank you to the entire Kinesio Taping team for putting in the support that we needed all the time to also make this conference a reality. Last but not the least, thank you goes out to Dr. Kinesio Taping also for introducing us to this whole world of taping, which has benefited us in many ways. So I'm going to share my screen now. My topic for today's presentation is the use of kinesio taping and a comparison of its benefits to those of dry needling in the treatment of myofascial trigger points. So as we know that myofascial trigger points is a very common occurrence in our clinical practice. And now we have got these two new tools, which is dry needling as well as kinesio taping in order to treat it. So I've put out a few studies out there to try and compare the pros and cons of each method. And then I'm going to also share a little bit of my personal experience going forward in the lecture. So our favorite man in KTAI, Dr. Kinesio Taping, he's a doctor of chiropractic. He's certified in acupuncture and moxibustion. He's published a lot of research, and he is a founder and director of the Kinesio Taping Association International. Now, Dr. Kinesio Taping, way back in 1979, developed the kinesio taping method, and after a few years, he also developed the kinesio text tape, which was designed to suit the kinesio taping method. And research still continues to go on over the last 40 years. Now, the kinesio taping method is basically an entire process of assessing the bodily systems in order to know where exactly is the pathology and how can we exactly treat the patient to give him the best results. So Dr. Kinesio Taping always emphasizes tape with wisdom, which means that we need to go through the entire assessment process. And once you're qualified and trained into doing those assessment process, you will be able to give an accurate taping application for that particular individual at that particular time. Kinesio taping is now popularly used all over the world, and like Dr. Kinesio Taping very commonly says, that treat with the tape what you treat with your hands. So anything and everything that we are going to use our hands for, we are going to use the tape in order to treat it. Kinesio taping works with the body's natural healing process to bring about homeostasis. So the objectives of today's lecture is, number one, I'm going to give a brief introduction to the myofascial trigger points and its clinical presentation. We are going to understand the proposed mechanism of the beneficial effects of kinesio taping in the treatment of myofascial trigger points. And then compare the effectiveness of kinesio taping and dry needling for the treatment of myofascial trigger points. So what is a myofascial trigger point? It is nothing but an area of hyperirritability which is present inside a taut band of a skeletal muscle or the fascia surrounding that skeletal muscle. It is usually very painful on compression. It can refer pain to different body parts. It causes motor dysfunction, sensory dysfunction, and also autonomic phenomena. Causes of myofascial trigger point could be many. There could be acute overload, chronic overload, repetitive injuries, direct trauma, referral pain from the visceral diseases. Emotional stress is also one of the big causative factors for myofascial pain. And diagnosis of myofascial pain, like most of you might be knowing, is we need to first palpate the taut band within the muscle and then look out for that exquisite tenderness, the exquisite spot tenderness of a nodule in the taut band. Patient's pain recognition is one of the diagnostic criteria for the diagnosis of myofascial trigger point. There is painful limit to the passive range of motion and there is twitch response. So how does a myofascial trigger point develop? Myofascial trigger point develops because an abnormal or sustained overlapping of the actin and myosin filaments. Now, like you all know, that actin and myosin, they overlap on each other, and this is how a normal muscle would contract. Now, this happens in the presence of calcium. Now, in a muscle membrane which gets injured or damaged because of trauma, there is continuous depolarization of the muscle membrane, because of which there is continuous availability of calcium at the site of contraction of the actin and myosin, or overlapping of the actin and myosin. And because of this, the actin and myosin stay in a sustained state of contraction. Now, when this contraction reaches about 30 to 50% of the maximum effort, the surrounding capillaries get compressed, because of which there is ischemia and there's a relative increase in the metabolic demand. Because of the increase in the metabolic demand, there is an energy crisis which develops, and that sets off a cycle, a vicious cycle of energy crisis. Now, in a normal situation where there is a nerve potential that comes through the nerve ending and then depolarizes the muscle membrane, the calcium pump is operative, and the pumping back of calcium from the site of actin and myosin overlapping happens in the presence of ATP, or energy. Now, whenever there is an energy crisis, this calcium pump fails, and the calcium just stays there at the point of overlapping, or at the region of overlapping of actin and myosin, which sustains the contraction even more and increases the local metabolic demand, and thereafter the cycle just continues. So as you see into this picture, we have to intervene at any of these points over here in order to break this circle of energy crisis. Now, traditionally, the methods that were used to do this was stretching, PNF techniques, and so on, or compression on the local trigger point, which helped to release the contraction of the actin and myosin and release the trigger point, and hence the energy crisis would be also sorted out. And now we have got these two new tools which are known to be of immense benefit in the treatment of myofascial trigger points. So dry needling and kinesio taping. So what is the clinical presentation? The first complaint that a patient would usually come to you with, who has got an active trigger point, is the pain. And pain comes from the direct injury to the muscle membrane. So muscle nociceptors take up about 50% of the composition of the muscle nerves. And there is nociceptors also in the surrounding connective tissue. Now, release of chemicals like bradykinins, prostaglandins, and other neuroreactive substances causes sensitization of the nociceptors, because of which there is pain. And these chemical substances, they are also known to be causing inflammation, especially substance P and CGRP, which cause vasodilatation, plasma extravasation, and as a result of which there is an inflammatory cascade that happens, causing a local inflammation and local edema. Now, needless to say, whenever there is a local edema, there is congestion in that space, and inflammation is actually a healing process of the body. But when it goes beyond control and causes more congestion, we need to take care of it so that the healing process continues and is not hampered in any way. And the third dysfunction that happens is the motor dysfunction. So there is limited range of passive movement, mainly due to pain, because muscle fibers are already under a lot of tension. When you try to give resistance to the muscle and ask the person to contract against that resistance, there is a lot of pain. If you manually passively stretch the muscle to the end range, there is painful end range of motion. And there's impaired motor control strategy, which is all the surrounding structures. There is a motor control strategy in any movement that we do. So the surrounding structures start to behave abnormally as well. So that includes the antagonistic muscles, also the tendons, ligaments, fascia, nerves, and so on and so forth. So everything around the affected region starts to behave a little bit abnormally, trying to overcome that problem which is persisting. So now the question is, can kinesio taping help? Is it sham? Is it placebo? Is it just color therapy, or does it actually work? Right, so now there's a study which was done, which compared the kinesio taping to sham taping. They studied the patients were randomized into 3 groups. There was a kinesio taping group, kinesio taping plus exercises. There was a sham taping plus exercises, and then there was a control group. And evaluations were done at baseline, post-treatment, and 4 weeks after the treatment. And immediate effect was also assessed by visual analog scale, grip strength, immediately after real and the sham tapings. And they found out that kinesio taping, in addition to the exercises, is more effective than sham taping and exercises only in improving the pain in daily activities and arm disability due to lateral epicondylitis. The aim of the study was to, another taping study over here, the aim of the study was to investigate the effectiveness of kinesio taping and sham kinesio taping on pain, pressure, pain threshold, cervical range of motion, and disability in the cervical myofascial pain syndrome patients. Now, patients were randomized into 3 groups: kinesio taping plus exercise, sham taping plus exercise, and a control group. And all the recipients were provided with a home exercise program, including strengthening program. Now, there was a statistical difference between the groups regarding pain and pressure pain threshold. Like when you press onto the myofascial trigger point, the sensitivity that the patient tells you about. Then there was a statistical difference also in the cervical flexion extension range, but no statistical difference in rotation, lateral flexion, and disability. So now we've got a working background to try and figure out how is it that kinesio taping might help. So this is a proposed mechanism on how kinesio taping can help. Now, there are 2 effects that can be summarized, the neurophysiological effects of kinesio taping. Number 1 is the effect on fluid dynamics. And number 2 is the effect on fascia tissues, including the muscles, ligaments, tendons, etc. And the effects are different with changing tensions. So if you've got less than 50% tensions, you create a decompression effect or decongestive effect because of the recoil effect of the tape. And if you've got more than 50% tensions, that is more proprioceptive, more supportive and compressive. So now look into this figure. This is a cross section of the skin where on one part of the skin there is kinesio tape and the other part of the skin, the tape has been peeled off. So if you try and compare the structure underneath over here in the dermis region, you will find that there is a relative increase in the space of the dermis. So that area seems like decongested already. While over here, there is relative compression, compressing the blood vessels, the lymph vessels, and so on, and all the receptors over here, which are there in the dermal area. So if you have any fluid accumulation in this region over here, without a kinesio tape in this small space, you are creating even more congestion, which is going to cause sensitization of the nociceptors. So with the kinesio tape, we are hoping to increase or lift the skin and also increase the space underneath the skin in the subcutaneous tissues to try and decongest that area and release or rather improve the flow, the blood flow, to help the process of healing. Now, how does this happen? This happens because of the continuous structure of the fascia. So there's a facial system model which was described by Dr. Jean Giumberto, in which it describes that the fascia is a continuous structure from inside out, top to bottom, unlike what was traditionally thought that the fascia is divided into different layers, like there's a superficial layer or there's a deep layer. So here Dr. Giumberto says that fascia is a continuous structure with the blood vessels, the lymph vessels all intervening in this structure. So if you're in a position to lift the skin, along with the skin, the fascia lifts up, and with that lifting effect, there is more space in the underlying tissues. So if you're able to create more space by lifting and separating the tissue layers of the body, there is movement happens when the lymph and blood flow, they start to move more freely in that expanded space. And then there is cooling which occurs as fluids trapped in the tissues are released and they flow back into the system. Now this is another diagram which is clearly showing what happens underneath your skin. So in the top picture, you see that there is no tape which is applied to this injured muscle. And there is lymph and blood collection in this subcutaneous tissue, which is over here, which is kind of not flowing freely. Now over here in the second picture, you've got a kinesio taping application which has lifted the skin up, and along with that the subcutaneous tissue, creating a little bit more space for the blood and the lymph to flow away. And you have a nice happy muscle over here. So this is going to start the process of the natural healing of the body. So now here was a study where they evaluated the immediate and short-term effects of kinesio taping on the myofascial trigger points in the upper trapezius and the gastrocnemius muscle. So it was demonstrated over here that kinesio taping application positioned directly above the myofascial trigger points decreases the pressure pain threshold immediately after application and also 24 hours later. Now, this control group over here had the taping application, but a few centimeters away from the myofascial trigger point. So that was the control that was compared over here. So how do you go about applying the kinesio taping test? Dr. Kinesio Taping has given us a system of assessment in which here he demonstrates the manual direction test tissue decompression. Tissue decompression, it not only helps us to select the level at which we need to target our tissues, so the level of affection, whether we are working just at a dermis level or we are working at a slightly middle level or deeper inside. So manual direction test, placing the hands and evaluating the patient is going to give us an idea of how we are going to select our target tissue. And second, to help to find the therapeutic direction which is most beneficial. Now, finding the therapeutic direction is extremely important. We cannot be just applying the tape from left to right or right to left. We need to find the most appropriate therapeutic direction in order to give the best results for our patient. Now, these are a few space correction applications over here, which we tend to use in inflammatory conditions. On the left-hand side here is a donut hole application. Here you see a fan cut. This is not exactly categorized as a space correction application, but we do tend to use it for inflammatory conditions and edema. Over here we have the EDF webs, which are overlapping each other in order to try and increase that space of the underlying tissues, and then a star application with the center in the middle, with the tension in the middle of your tape. Right, then the third dysfunction that we talked about was the motor dysfunction. Now, what happens in the myofascial trigger point is that there is overlapping of actin and myosin, which causes the pain and all the sensitization. So our aim is to just try and normalize the length-tension relationship of the actin and myosin and bring it to this position where there is optimal overlapping for an optimal muscle function. So kinesio taping can alter the length-tension relationship of the muscle when applied from insertion to origin. The recoil effect may inhibit the motor neurons by stretching the Golgi tendon organs at the distal end of the muscle. Kinesio taping can also bring about a change in the proprioception and biofeedback. So a lot of times we do see that there is abnormal movement pattern. So if you are in a position to affect this movement pattern in some way by giving a biofeedback or a proprioceptive feedback via our tape, we are in a position to affect the neural pathways to retrain the brain and get into a normal movement pattern. So K et al. Applied the K tape combined with home exercises on patients who suffered from shoulder pain from insertion to origin. And he found significant improvement in the pain and disability in the taping group 1 or 2 weeks later. Van et al. Also investigated the effects of kinesio taping method for the relief of myofascial syndrome. Taping with insertion to origin technique was performed, and they found that there was a statistical difference in the pain relief immediately after the treatment. They considered that this effect was because of the stretching of the taut band and stimulation of the skin receptors. And this improvement was also statistically significant 24 hours later. So once again, when we are applying the taping to the muscle, we need to do it with manual direction testing. So this is a system of assessment that Dr. Kinesio Taping has again told us about. So we need to apply the tape with first assessing the direction in which we need to apply it, and then go ahead with application. So over here you see these two tapes are muscle inhibition tapes, or rather treating an overactive muscle is what we call now. And over here you see a functional correction taping application to treat the function. Now there's another mechanism in which kinesio taping can probably help in reducing the pain, which is by stimulating the mechanoreceptors like Ruffini corpuscles. So when the skin is stretched, the Ruffini corpuscles get stimulated, and Ruffini corpuscles are known to be responsible for the activation of descending inhibitory pathways and gate control pathways. So if you are in the position to affect these Ruffini corpuscles by using the tape, we are probably in a position to give that gentle stimulus that is required for the body to help reduce the pain. And apart from that, we should not forget to see the entire, the secondary dysfunctions, which involves the rest of the entire body, including the tendons, the ligaments, the nerves, the fascia, and other functional abnormalities that might have been coming. So treating just the site of pain is not a very good idea. We need to look at the entire body and try and see what other places could have been affected. And for that reason, knowing the facial lines of affection is also quite important, so that you are able to find out where exactly you need to look for in order to try and treat your dysfunction. So consider your body to be a cocoon, a tightly wrapped cocoon. So if you have got an injury at one particular point, the body tries to recoil towards, or rather tries to go into protective spasm, which is a protective spasm for a reason, to try and prevent further injury. So now you need to try and see at the other areas of affection which are probably under tension because of the movement of the body tissues towards the injured site over there. And hence treating just the site of pain, not just the site of pain, but treating the rest of the body is also very, very important. So Osteohughes here treated patients of patellar bone dislocation with kinesio tape based on the concept that stimulation to the mechanoreceptors from the skin to the tape would cause a proprioceptive effect. And he found that indeed the balance and motor control were better than the previous status. When performing the kneeling down or eccentric contraction of the leg in the usual weight bearing, the VAS was decreased. So here is a study which shows that the kinesio taping does have an effect on the proprioception. So what we are doing over here, we are trying to change the perception of pain into the patient's body. So these are applications of kinesio tape. This is a mechanical and functional correction application. This is just a functional correction application over here. This is for the wrist drop function. So basically our aim is to get wrist extension. Onto this figure, onto the right, you see tendon application for the Achilles tendon and a muscle application to the adjoining gastrocnemius muscle also. A schematic representation of how kinesio taping is going to help. So there is an increase of space in the soft tissues, which causes facilitation of circulation. Somatosensory stimulation, proprioceptive stimulation causes gait control, or rather helps in gait control and reducing the pain. Immobilization helps to prevent further injury, and Golgi tendon organ stimulation gives that biofeedback which is required for the body in order to try and change the perception of pain again. And that is how we are going to get all the beneficial effects. Again, placebo is also a very, very important effect into treatment of our patients. So the whole process from right from the time you start to receive your patients, the way you assess your patients, the way you talk to your patients is going to add to the placebo effect, apart from the fact that you're also going to do your manual therapy. So placebo, yes, definitely does have a role into kinesio taping also. So now let us come to dry needling. What is dry needling? Dry needling is the use of solid filiform needles for the treatment of myofascial trigger points. And we've got superficial dry needling and deep dry needling. Superficial dry needling is responsible for reducing the pain which is there in the which is caused because of the myofascial trigger points. As was suggested by Peter Baldry in one of his papers, he had mentioned that superficial dry needling is sufficient to try and take care of the pain, and deep dry needling is required only if you have got a motor dysfunction. So while treating muscles like the scalene muscles, where there is a big risk of causing a pneumothorax to the patient, superficial dry needling is all that is required to try and reduce the pain in that muscle. Now let's come to the big question. Should we use dry needling? Should we use kinesio taping? Or should we use both together? So here's a study to compare the effects of trigger point dry needling and kinesio taping in the management of myofascial syndrome during a 3-month follow-up period. The results that were found was that during the management of myofascial pain syndrome, pain can be reduced comparably by both dry needling and kinesio taping. Restriction in the range of motion in the neck region and the quality of life are more remarkably reduced by dry needling. Both dry needling and kinesio taping can provide an increasing effectiveness up to 12 weeks. Another study aimed to determine the relative effectiveness of these two treatments in the trapezius muscle, and they found out that kinesio taping was as effective as dry needling in the treatment of myofascial syndrome. Kinesio taping is thus a non-invasive alternative to dry needling, and kinesio taping therapy resulted in a greater change in pain and disability scores than the dry needling trigger point therapy. So we can use it wherever dry needling is contraindicated, or the patient is not willing to take the invasive treatment technique, or because of the comparable effects of dry needling and kinesio taping, we can also use kinesio taping as the treatment of choice. A third study, the comparative efficacy of dry needling, kinesio taping, and physical therapy in patients with myofascial pain syndrome, where they studied the effects of kinesio taping, traditional physical therapy, and dry needling. And they found out that a single dose of dry needling, 3 doses of kinesio taping at 3-day intervals, and 10 sessions of physical therapy have a favorable effect on pain and functional status in the early period, that's up to 1 month. And the improvements in pain and dysfunction, functional disability are similar between the groups. So needless to say, again, we can use kinesio taping as a non-invasive method to treat myofascial pain syndrome. One more study to compare the effectiveness of kinesio taping and dry needling. This was, I think, was done for whiplash patients where they assessed, this was again related to trigger points in the trapezius muscle. Here again, they concluded that kinesio taping may be a choice of trigger point inactivation in patients who do not want to be needled. Now, we all know those who have been needling, post-needling, there does tend to be some soreness in the muscles. So this soreness is because of various reasons, which is beyond the scope of discussion of this lecture. So to try and treat that soreness caused because of dry needling, it is proposed that we could possibly use kinesio taping also. So here was a study where they used kinesio taping application following the dry needling treatment. KT space correction technique utilizing the kinesio text gold tape had a greater effect in reducing the level of pain associated with dry needling in the trapezius muscle trigger point when compared with either non-proprioceptive hypoallergenic tape or a control group. Now, kinesio taping, here they found out that kinesio taping was not so effective for reducing the post-needling induced pain in people with mechanical neck pain. So then we come to the discussion about what exactly is a good strategy after we know this theoretical background. Now, in my clinic, I tend to go through all of these points before I make a decision whether I want to use kinesio taping, dry needling, or I want to use both the treatment techniques. So the number one thing that you might need to remember always in your mind is the patient's emotional status. Patients with myofascial trigger points, active myofascial trigger points, are going to be quite emotionally perturbed as they approach you. So we need to evaluate and judge the patient's emotional status, and then the whole process, right from receiving the patient, talking to the patient, the history taking, the whole treatment process, which adds to the placebo effects, all of that is going to count towards your decision-making process. So if you feel that the patient is emotionally not feeling too great, it's probably a good choice to stay away from needling and then use kinesio taping as the treatment of choice over here. Patients' previous experiences play a good role. So some patients come asking for a kinesio taping treatment because they have got a beneficial result from kinesio taping. Likewise, some might not have experienced a good result, and hence it might be difficult for them to accept kinesio taping, and they would be more open to accept any other form of treatment for their pain. The third is the reactor type. So it is the responsiveness of your patient to your treatment. So there are strong reactors, there are average reactors, and there are weak reactors or responders. And if you, I generally tend to use kinesio taping for the strong reactors because these are the reactors who tend to quickly respond with a jump or a shout, like strong reactions to any kind of treatment that you're trying to give them. You also need to consider the contraindications and limitations. So in cases like pregnancy, which is a relative contraindication to dry needling, in cases like osteoporosis and osteopenia, where dry needling is not considered safe, other cases like spider veins, where dry needling probably could be a tricky situation when we're trying to needle those patients. So or geriatric patients and pediatric patients who may not tolerate dry needling. So these are the things where kinesio taping becomes the treatment of choice. Placebo effect plays a big role again. So I have this habit of offering the tapes in front of the patient and asking them to choose the color of the tape that they want to use. Kinesio tape comes in different wonderful colors. There's a shocking pink color. There's a soothing blue color. Then we have got a black color, white color, and a beige color. So it's up to the patients, and that adds to the placebo effect that you have already probably created in the whole treatment session. Then time considerations also need to be considered. Most of us work in time slots of 30 minutes or 45 minutes when we have a patient in front of us. So we need to assess how much time is left for us to, treat that patient. Uh, your previous clinical experience is the only thing that is going to help you in deciding which treatment would fit into that time limit, of course, and also which is going to be beneficial for your patient. Now, triannealing and kinase taping are always given in conjunction with your other physiotherapeutic treatments. So we do not just send a patient home with a piece of tape on him. So it is always done as an adjunct to your other physiotherapeutic treatments. So considering the time limitations is also very important. Intensity of the post-needling soreness. Now here, you need to consider how much soreness the patient has got after your needling session. So typically I use a mix and match of both the session, both the techniques, especially if I've needled muscles like the gastrocnemius or the trapezius or the sternocleidomastoid, because these muscles often tend to cause a bit more soreness after the needling, and the patients may not be happy to take any further kind of treatment with the dry needling at the same place in that case. So here kinesio taping becomes the treatment of choice again. And patient's willingness to undergo an invasive treatment. So here, if the patient doesn't give consent to either dry needling or kinesio taping, you cannot use either of the techniques over here. So now, based upon our clinical observations, both methods have been found to be effective in relief of pain. Kinesio taping has a wider applicability in terms of its use across all age groups and types of conditions treated. For example, neurological conditions can be very nicely treated with kinesio taping. Patients who have got vascular abnormalities like spider veins, as I mentioned earlier, geriatric population, pediatric population, pregnant women can also be treated. Also, in post on-field injuries where dry needling probably could cause more soreness, especially if the player is going to go back onto the field. Dry needling might cause more soreness, and then when he's going to exercise more, it's going to just increase the post-exercise soreness and increase the DOMS. So probably using kinesio taping and your manual techniques is a better choice on-field sports injuries. Kinesio taping is a treatment of choice where there are other contraindications of dry needling or if an invasive treatment is not accepted. Because of the hypoallergenic qualities of kinesio tape, it would be a treatment of choice again, like I said, for pediatric and geriatric population. Kinesio taping is useful to reduce the post-needling soreness also, and use of kinesio taping post-treatment will help in reducing pain and hence reduce the overall recovery times. Now, as a manual therapist, using these two techniques into my clinical practice has definitely reduced my physical efforts into treating myofascial trigger points, especially those deep-seated myofascial trigger points where you keep on putting a lot of pressure to try and reduce or release those trigger points. These two techniques have been extremely beneficial for me. Use of kinesio taping helps in retaining the benefits achieved after manual therapy and dry needling in between the clinical visits. So this was the whole intention of Dr. Kenzo Kase to try and invent the kinesio taping method and the kinesio text tape. Very often we do find that patients, after we send them home, they tend not to follow our advice. Like they might go and sit in a bad posture. They might just do things that we have asked them not to do. They might overwork, over-exercise, lift or carry some things, and the result is that they come back to us with same kind of pain. So after we have done all our manual therapy efforts into giving the patient or rather treating the patient, we can retain these effects by using the kinesio text tape and then giving the exercises to the patient along with the kinesio text tape. Now, in my clinical practice, I tend to usually combine both the methods a lot. So I would treat a myofascial trigger point using the needles, then stretch, and then apply the kinesio tape and give the home exercise program to the patients who have these myofascial trigger points. And definitely it has helped to reduce the number of visits to the clinic using these two techniques together. And last but not the least, using kinesio taping and dry needling together both reduce the physical effects of the manual therapist when treating the myofascial trigger point. All right, so with this, we come to the end of my lecture. If you have got any questions regarding this presentation or otherwise any information required, you could please get in touch with me. Thank you very much for your patient listening.